There has never been a more exciting time in healthcare than there is right now. We're looking at the whole person. We're not just looking at the disease or the surgery, and that is certainly something that's unique from any other healthcare system I've worked at in my 30 years. We're all looking at the patient through the lens of our own discipline and then coming together to address the patient's needs, addressing the social determinants of health, eliminating some of the barriers, and supporting them during their healthcare journey.
What's really frustrating is when you see a patient in the hospital and you know they have so many unmet needs and you have nothing you can do except provide the care in the hospital and send them out. And if they don't start making changes now, they're going to be back in the hospital. We're the stopgap.
Oftentimes we see patients who are scared, overwhelmed, feeling out of control with a new diagnosis. And through this team-based care model, we're able to provide support to them.
I love driving big trucks, always will. It's just part of who I am now. I feel like that's where I belong. I kept wondering how come I'm tired all the time and I can't stay awake while I'm driving. I kept trying to ignore it, like, I gotta run. This truck gotta be running. I gotta run. I ain't got time to go to no doctor. And this is what I told myself until my body said, no more. When I lost my CDL, I went to Cone Health, to the fibrillation clinic. They ran tests on me, and that's when they discovered that my heartbeat wasn't in rhythm, and and then my blood pressure was through the roof. It was discovered that I got sleep apnea. So I'm getting hit with everything. I was no longer able to support myself. I wasn't able to earn an income. I felt like I can't do anything for anybody. I'm useless.
The way in which we identify some of these social determinants of health really begins with our CMA through a motivational interviewing process where you're asking open-ended questions to really elicit some of the needs that the patients are struggling with, some of the barriers, and get a better picture of what their home life is like.
How hard is it for you to pay for like your very basics, such as like food, utilities, medical care, heating, anything like that?
Do they have a roof over their head? Do they have the proper food to eat? How are they going to get to that appointment? How are they going to pay for those medications? We have to help them figure out ways so that they can really be successful and lead a well life.
In order for me to get back on track and start feeling good about myself, I had to get over certain obstacles. My cell phone had just went off. Now I'm using Wi-Fi. Half the time it works, half the time it don't work. The doctors got to be able to contact me. The social workers got to be able to contact me. Couldn't pay my car insurance. And I didn't know how I was going to go back and forth every time they wanted to do a checkup. And when they prescribed me a CPAP machine, that was almost $1,000. And I'm paying that out of pocket. I couldn't afford it. I needed help. I wasn't going to ask. I just, us men, we just hard-headed.
Most people are proud and will say, I can handle this, or I'll get through it, or I'll figure something out. And when we try to help them see that we're just helping them bridge this gap so that they can get back on their feet, it opens the door for us to be able to help them. And then we utilize the Patient Care Fund to provide them with some of the resources that they may need to overcome some of their barriers.
To know that there are these resources available gives me hope because it gives me the power to assist a patient. When a patient has that realization that they're not alone, they take those extra steps to taking their medication, coming to appointments. They don't have to decide between paying for co-pays or paying for their meals. It makes me proud to say that I work for Cone Health.
I think the Patient Care Fund has helped me as a provider because we don't have the red tape to go through. It's not sitting on somebody's desk waiting for action on Monday. We can start working on things now.
Something as simple as a phone, a small fee to pay for his CPAP, changed his life dramatically. He was not going to get back to work if he didn't get that CPAP. And he wasn't going to get that CPAP if he didn't have a working phone. And a little bit of money from the patient care fund got somebody back to work. Ultimately, there's absolutely nothing that we can't do because of that patient care fund. It helps patients in ways that just never were options before in the past.
I felt like they didn't want me to come back. That's how I felt like. They don't want me coming back. They want me to achieve my goals. These people really care. They really invested their time in me. My future looks good. My future is bright. My future is bright. I credit Cone for 95% of it. 95% of it.